Okay, Dr. Dailey here. Today we're going to talk about dietary modifications for peripheral neuropathy. Now, all of us want to get better, but very few of us want to make changes that are required to actually get better. Now, I will say that in our case, the laser is as close to a magic wand as you can get because it is so very effective. But I have found that we get quicker results and longer lasting results if we have a multi-pronged approach. And one of those prongs is dietary modifications. So let's talk about that. A balanced diet plays a crucial role in managing peripheral neuropathy. Proper nutrition can help reduce the symptoms and prevent further nerve damage, which is vital. Beneficial dietary changes would be adding anti-inflammatory foods, whole grains, healthy fats, and hydration. Now, I will say that if you can do without grains, you're better off doing without grains, only because the grains that you get here in the United States are basically just highly processed foods. But for anti-inflammatory foods, you want to eat foods like leafy greens, berries, fatty fish to reduce inflammation. Healthy fats would include avocados, nuts, and olive oil. Hydration. Now, guys, this is vital. Most people don't drink enough water, but hydration is vital to support overall nerve function. If you're wondering how much water you should drink, just take your weight and divide it in half, and that's how many ounces of water you should drink. And really, water is what we're looking at. The amount of tea that you drink or coffee, those actually count against you. So we want to be drinking half our weight in ounces of water. Diet plays a crucial role in managing peripheral neuropathy. While no specific diet can cure peripheral neuropathy, certain dietary choices can help manage symptoms and promote overall nerve health. Here are some dietary recommendations. So, we want to be consuming nutrient rich foods. We want to get plenty of B vitamins. They are vital for nerve function. So, vitamin B1, B6, B12, folate, which is B9, vitamin D, vitamin E, omega-3 fatty acids, and as I mentioned, antioxidants. So it's great when you can get these through your foods. And that's what we're talking about in this particular segment. I am going to talk about nutritional intervention, where we're actually introducing these into your system as supplements. But B1 is found in grains, pork, and legumes. B6 is found in poultry, fish, potatoes, and non citrus fruits. B12 is found in fish, meat, poultry, eggs, milk, and other dairy products. Folate or B9 is found in leafy green vegetables, nuts, beans, and fortified grains. Vitamin D is found in fatty fish like salmon, mackerel, and tuna, cheese, egg yolks, and fortified foods. Although fortified foods are basically stripped of all their nutritional value and then they're fortifying with synthetic vitamins, so that's kind of counterproductive. Vitamin E found in nuts, seeds, spinach, and broccoli. The omega-3 fatty acids found in fatty fish like salmon, mackerel, and sardines. Antioxidants, vitamin C, which would be citrus fruits, strawberries, bell peppers, and broccoli. Alpha lipoic acid is something we're going to talk about in our next segment. It's found in spinach, broccoli, and potatoes. And then glutathione, which is, you could call it the mother of all antioxidants, is found in asparagus, avocados, and spinach. So when we consider dietary recommendations, low sugar, low refined carbohydrates, that is vital. High blood sugar levels can worsen and cause neuropathy, especially in diabetics. So we want to limit sugar and refined carbohydrates to maintain stable blood glucose levels. Then, as I mentioned, the anti inflammatory diet, I mentioned the hydration. We want to limit alcohol. Guys, excessive use of alcohol can worsen and even cause neuropathy. So we've got to limit the amount of alcohol. Healthy fats, as I mentioned before, avocados, nuts, seeds, olive oil. Lean protein, like chicken, turkey, fish, tofu, and legumes. So, foods to avoid: Processed foods, they often contain unhealthy fats, sugars, additives that can worsen inflammation and increase your level of blood sugar. Sugary foods and beverages. High sugar intake can lead to spikes in blood glucose, which can aggravate neuropathy symptoms. In other words, we're often driving our own symptoms. So you got to stop that. We've got to remove the cause of the problem as we treat it. Trans fats, which are found in many processed and fried foods, trans fats can increase inflammation overall. Excessive salt, high sodium intake can lead to water retention, increased blood pressure, which may affect circulation and, of course, nerve health. Now, we're about to talk about this in our next segment, but in some cases, supplements might be recommended to ensure adequate intake of essential vitamins and minerals, especially if dietary sources are insufficient, and for most people, they are. Always consult with a healthcare provider before starting any supplement to avoid potential interactions or side effects. By adopting a balanced diet rich in essential nutrients, antioxidants, and anti inflammatory foods, individuals suffering with peripheral neuropathy can help manage their symptoms and support overall health. Thanks, guys. We'll see you soon.